Adolescence is a critical period of development because of the rapid brain development during this phase of life. Many things, of course, develop in a positive way, but also many things can go wrong. Indeed, 50% of all lifetime psychiatric disorders have their onset by age 14. 20% of all teens likely have a psychiatric disorder, but 70% of those never receive treatment. Another way to think about the impact of this problem is that the top 3 causes of death in adolescence are accidents, homicide, and suicide. The first 2 certainly have some relationship to behavioral problems, including substance abuse. And the third very directly relates to psychiatric disorders, and in particular to depression. Depression occurs, in estimates indicate, nearly 15% of teens, and is because it can result in suicidal behavior, even completed suicide, is of great concern in our community and indeed in many communities across the country. In addition to depressed mood, or for teens sometimes more of an irritable mood, other indicators of clinical depression would include suicidal thinking, loss of interest in usual activities, prominent feelings of guilt, low energy, poor concentration, changes in appetite, or changes in sleep. Several things can prevent teens from getting help for psychiatric disorders and for depression in particular. One is stigma. Stigma, of course, was a much bigger problem half century ago. When I was a kid, if people went to see a psychiatrist, I don't think they talked about that at all. Nowadays, it's becoming more acceptable to talk about seeking help for mental health problems. It's more acceptable for parents to talk to teachers or health professionals about getting help for their kids. But it's still a problem. It's still something that people feel awkward about. And I think because of the self-consciousness that is probably somewhat normal for teens, this problem can be exaggerated in teens, especially teens who are feeling badly about themselves. Another barrier to getting appropriate help for psychiatric disorders is, frankly, access to care. The healthcare system as it's currently constructed tends to make it more difficult to get help for psychiatric disorders than for other kinds of disorders. And as a result, parents of teens or teens themselves often, although they have coverage, have a hard time understanding how to get to that coverage. There's many ways in which we're seeking to help kids access appropriate care. First of all, we have the Behavioral Health Center here at the Mills campus. For adolescents, here we have inpatient units serving 13 to 17 kids at any given time. We also have a very nice intensive outpatient program. It's an after-school program where kids come after school, receive intensive family and group-based therapies, and then go home at the end of the day and resume their normal life. That's an alternative to inpatient hospitalization for kids who may be able to be helped without being in an overnight program. Another innovative program going on in our community, and one in which both Mills Peninsula and PAMF doctors are participants, is the HERD Alliance. The HERD Alliance was developed several years ago in response to, sadly, a suicide cluster in the greater Palo Alto area. And the Alliance is health professionals, school professionals, law enforcement, other community interests working together to help identify teen depression and to get help to teens with depression. I love working with teens. It's very exciting work. One reason is that teens get better, perhaps in part because of the active brain development at this point in life. There's a rapidity of development that can occur that can then have an impact over a long period of time. When we intervene with a teen during their, between say 13 and 20 years old, there's many, many decades of life during which they can have a better life, and that life can be shared with their family and with all of the people they come in contact with the rest of their hopefully long life.